Good morning, Bespoke Babes. It's Dr. Kim. Happy Canada Day. I hope everyone has a great day planned for them. So this morning I want to talk about hyaluronic acid and the difference between high molecular weight and low molecular weight hyaluronic acid. So first of all, hyaluronic acid is a natural component of our cells. It exists in the dermis, the deep layer of our skin, and it holds all the different cells together and is very important for moisture content and structure of the dermis. So you will see hyaluronic acid in all sorts of different skincare. But the hyaluronic acid that we want, the high molecular weight hyaluronic acid, is a big particle. So it will not penetrate deeply through the epidermis. So skincare that has high molecular weight hyaluronic acid is going to feel really great. It's going to sit on the surface of your skin. It's going to suck all sorts of moisture in. It's going to plump up those fine lines, and it's anti-inflammatory. So it's going to take down skin irritation. It's going to make your skin feel great, but it's basically going to be gone the next time you wash your face because it's just sitting on that superficial layer of the skin. So it can feel great, it can look great, but it's not actually getting down where we need it. Low molecular weight hyaluronic acid can penetrate down through the skin, but that's not the one that we want. High molecular weight hyaluronic acid, as I said, is anti-inflammatory. It promotes scarless wound healing and collagen production. So that's the one we want. Low molecular weight, although it can penetrate through the skin, it's actually pro-inflammatory and it promotes wound healing with scar formation, and it does not promote collagen production. So what we really want is this high molecular weight hyaluronic acid, and we want it in our dermis. That is where we need it, but it can't penetrate the skin. It can't penetrate the skin without help. So how are we going to get it there? Well, that is where our V2 injector comes in. So this system, we load with a syringe here of our Redensity 1. This is high molecular weight hyaluronic acid, and in here is a cocktail, a skin health cocktail basically, of amino acids, vitamins, and minerals that are really important for skin health. So we are going to use our high molecular weight plus our V2 injector. There is a disposable tip that goes on this with small needles to actually inject it down into the dermis. Of course, I always put topical freezing on first. Our console here, I'm not sure if you can see it, but the console, we can set the depth as well as the dose of our skin health cocktail that's being injected. So this can be a very precise and targeted treatment to problem areas. Now, I like to amp it up and pair it with our microneedling. So I've talked about microneedling before. You know that we use our little pen and our little disposable needles here to poke small little tiny holes in your skin down just to that top layer of dermis to again promote collagen production and turnover of the outer layer of the skin. So we combine them together. We do a microneedling all over and then target our real problem areas with our V2 injector and our skin health cocktail with high molecular weight hyaluronic acid. So I actually just did this combo treatment to myself on Saturday. Today is Wednesday, and you can see my skin's looking pretty good and healed already. I do have a little bit of sort of flaking around my mouth where I went extra hard because I hate those little lines that I'm starting to get. But basically I do microneedling all over the face, all over the neck, all over the upper chest. So basically I'm going to do microneedling. This is what I did to myself, all over my face, all over my neck, all over my upper chest, and then use the V2 injector and our Redensity 1 to hit the real problem areas. So here in the glabella, the crow's feet, nasolabial folds, the necklace lines, and of course those annoying upper chest lines. Now the V2 injector does have a little bit of a vacuum. It kind of sucks onto your skin and then injects, so sometimes you can get a little bruise. And I do have a little small bruise on my upper chest from where I did the injections. But we're only a few days out. It's Wednesday, I did it Saturday. My skin's looking pretty good already. I'm absolutely in love with this combo treatment. I did one for myself during the whole shutdown time about 6-8 weeks ago, and now I've done a second one, and I'm really loving what the combination is doing, particularly for my necklines, upper chest, and these nasolabial folds. So that is our Canada Day special. Happy Canada Day, everyone. A microneedling paired immediately with our V2 injector of our Redensity 1 Skin Health Cocktail. Of course, if you have any questions, you know to message me or post them, and of course I'll answer them. And if you have any ideas for other videos, make sure you send them in. I love it when I get questions and then I can do a video. Okay, have a great Canada Day, everyone.